it's interesting because healthcare is one of the few industries where we've applied significant technology and resources and data and analytics to it, and we get back that it's becoming less efficient. It's becoming more burdensome. It's not user friendly. It's but there. I mean, we end up telling these stories. There are other industries where it's made all the difference in the world. I mean, you can do things that you couldn't do before. Now, true, there are a lot of those stories within the EHR. We can now find correlations across multiple populations, and we can identify things a lot better and those kind of things. But that's not what the physicians are experiencing. So do you, or the clinicians? So do you spend a lot of time on the clinicians' feelings and burnout and their use? Does that get covered a lot in the survey?
Yeah, Bill. And as you say, that's one thing that, because we haven't been measuring, we've taken as universal fact that in healthcare, there's a Russian word for it, vobshe, just generalized across the board that this is just how it is, and it's not, because there's organizations that their clinicians report back to us extremely satisfied experiences with their EHR, and at those type of organizations, you have users who have really mastered how to use the EHR well. They have a great governance and communication structure where they're able to give feedback, and they love the EHR because it's able to adjust to be able to help them out. So when they need, they feel like they have a backstop and something that's helping them. And then they've learned that they're responsible for part of the success of their EHR. So they've had to personalize their experience. But a lot of those organizations are just happily doing what they're doing. And they don't know. I mean, everybody else is kind of whining. And I talked to one of the physicians that was from the highest satisfaction organization. So she had practiced, and then she had recently moved, and she was at a conference that I was speaking at. But she had been practicing in Oregon at Kaiser Permanente. Highest satisfaction group that we've measured among physicians. 92% of them report that their EHR enables them to deliver high quality care. And just getting 92% of physicians to agree on something, that means you're really doing a good job. And I said, this was just happenstance, and we talked about the frustration with EHRs. I had a slide up that talked about just general frustration with EHRs. She raised her hand and said, I don't get what this frustration is about. These things are amazing. They've helped us so much. And I said, can I ask you, and this was just dumb luck. I said, can I ask you, where have you practiced at? She said, I just came from Kaiser Permanente in Oregon. And I said, well, guess what? You're coming from the highest satisfaction organization. So she's not relating with her peers. And as they're talking and kind of nodding their heads and going, yeah, we hate EHRs. She's sitting there going, no, this is amazing. This has revolutionized the way that we practice medicine. And anyway, so just kind of an anecdote around some of this. But when you talk about burnout and some of the experiences that we're measuring on that, we've just started measuring burnout. We're using the single question burnout inventory from the American Medical Association. And what's interesting, whereas there's huge variation in EHR experience, variation in burnout by that measurement, and I know that there's others out there, so we've got to say what measurement we're using, but by that measurement, there's very little variation between different organizations. It's pretty steady. And so even just when you know that that the EHR success can't be that big of a driver of burnout because it's all over the board. We believe mathematically right now, I'm a statistician, we believe that about 10% of burnout is driven by the EHR. So organizations that have a better EHR satisfaction do have lower burnout, but it's only a reduction as you go to those lower ones, or a increase of 10% burnout where you have greater EHR satisfaction.